My name is Terry Moreau. I'm from Shreveport, Louisiana, and I have a bumpy nose. My nose feels bumpy and rubbery. My nose has gotten a little bit bigger on the right side. Sometimes I get boils on the inside of my nose, and they're really painful. I've always had a problem with my complexion since I was very young. My nose started growing about 7 years ago, and as my nose grew, I let my hair grow, kind of cover it up, balance it out. Breathing for me during the day is not that big of a problem, but at night I'll be gasping for breath because I can't get any air through my nostrils. When I lay down and try to fall asleep, I can't breathe because my nose is weighted down over my nostrils. And sometimes I put my arm over my head and hold my nose up with my fingers, and then I fall asleep like that. Sometimes I'll wake up in the middle of the night after I've fallen asleep and I'm not holding my nose up. I'll be gasping for air, and I wake up. It's really frightening. If Dr. Lee can help me, I believe it'll help me be able to sleep through the night better as far as my breathing. You know, there's lots of things that it'll make a difference in.
Hello.
Hello, how you doing?
Very nice to meet you, sir. Thanks for coming all the way out here. Where'd you come from?
Louisiana.
Louisiana. Well, welcome. First of all, you look like one of the members of ZZ Top. So I guess you're seeing us for your nose.
Yes, ma'am.
Do you know what this is? You know what it's called? Rhinophyma, it looks like, from this distance. Rhinophyma is like a severe form of rosacea. You might have heard of rosacea before. Some people, especially men, they can get a thickening of their skin on the nose in particular. Does it cause you pain, or does it cause any discomfort for you?
I have a hard time breathing. It's uncomfortable.
I'm gonna take a look, okay?
Yeah, whatever you need to do.
Terry is such a sweet, soft-spoken gentleman, really with this gruff exterior. And maybe he has this exterior, too, to kind of distract from this extensive rhinophyma that he has. This type of extensive rhinophyma is certainly a treatment that is not without risks. It involves quite a lot of your nose here. But it's really the front of your nose that you have the brunt of it. I just concerned mainly because this is a pretty large area with a good blood supply to it, so that's what I think about. Obviously, this is a big case of rhinophyma, and I don't want to promise the world that I can take all of this out in one get-go because there's risks. I know I have to take this off slowly and gradually. I mean, I never know what's under each layer here. I mean, who knows what you're gonna come across underneath there. And I'm gonna give it a try. I can't promise everything, but let's see what we can do there. Might be able to do it all today, or we might have you come back again.
Just do whatever you need to do.
There's only so much numbing that you can give any patient at any given day. Certainly at high levels, that can really affect your heart. That can actually cause toxicity to your heart. Let me numb up one side first, and let's see how well we can do this, how quickly and how efficiently with as little bleeding as possible and with the most comfort as possible. So it comes out of the little pores. Oh, sorry. That's just the numbing medicine coming out of the pores. That's why I wear all my gear, too. Today, I'm using the surgical electrocautery loop. It cuts through tissue, but at the same time, it's going to help to seal little blood vessels there so you have less bleeding. So she's gonna turn on this vacuum here. Make sure nothing ever hurts you. Cut that off. Rhinophyma is really a thickening of oily skin. You get these enlarged pores that oil can store in, right? Oil and keratin, or dead skin cells. Interestingly, a lot of the size of his nose doesn't have so much to do with actual skin there. There are big pockets of butter in there. There's big pockets of oil in there. These are some of the biggest butter pockets I've ever seen. It's doing well. It's like it's so dense in there, it gets harder to cut. Okay, so now I'm looking at his nose. I am getting a lot of moisture collecting on my electrocautery tool. And this is slowing me down because it's not getting hot enough to cut through the tissue. It's not as efficient as it usually is.
Feels better already.
It does? Oh, good. I like that. It feels better. You feel like lighter, maybe. Solid tissue here. It's getting smaller. You probably can see that a little out of the corner of your eye, though. You probably just want to keep your eyes closed anyways. Sorry, a little bit knife. Sorry. I feel like I'm on this Rhinophyma battlefield. It's like I'm hitting all these landmines of pocket butter, and I'm getting these blood vessels that want to ooze. And we have Terry, who's feeling some discomfort here. So now my goal is really focused on finishing the right side of his nose as much as I can. You know, I'm going to just trudge on through and get to the end, though. I've got to get to the flag. I got to capture it. Look at that. It's like a little treasure here, in a way. I mean, not sure how to get this down completely. Sorry. Oh, sorry. Let me put some numbing right there. Hold on. I'm sorry, making him cry. This is hurting you, huh? A little bit? Or a lot more? When you say a little, I know it means a lot.
It's not bad.
Oh, it is. Yes, it is. This little thing here. I think that it's unsafe for me to fully proceed here because we're really reaching the limit of a safe level of numbing that he can really receive within a 24-hour period. So I would really like to see how he heals and to come back another day and to remove the rest of it. At least now, this should improve his breathing tremendously.
It was 2 months ago that Dr. Lee treated me the first time. I was anxious to go back, and a month ago, she did the left side.
You did great the last time, so I know you're gonna do great this time.
She finished the job, and she just did great. Now they're both done, and everything about my life has gotten better. It looks like my old nose. Now when I sleep, I don't have to hold my nose up. Just great to feel normal, be able to go out in public and not feel like people are staring at me. I'm just real happy.